Hello everyone, my name is Dhalia Masud and I'm a plastic and reconstructive surgeon. And today we're going to be talking about breast reduction surgery and what it is, who it's for, and how can it genuinely transform the quality of life. Now, I've personally performed hundreds of breast reduction procedures, and one thing I can tell you straight away is that no two breast reductions are ever exactly the same. So let's revisit breast reduction surgery. Why do people consider breast reduction? Most commonly, patients come to see me because of symptoms associated with a large breast. Now, this includes persistent back, neck, and shoulder pain. It can be very difficult to find the ideal bra. For many people, it's not just about appearance, it's about function, comfort, and daily living. Why do people consider breast reduction surgery? Most commonly, patients come to see me because of symptoms associated with a large breast. This includes persistent back, neck, and shoulder pain, difficulty to find the ideal bra, which means it can be very difficult to exercise because of the pain, physical activity, skin irritations underneath the breast and the breast folds, deep grooves from those big, thick, heavy straps of the bras. For many people, it's not just about appearance, it's about comfort and daily living. And that's not the only reason. Breast reduction can also be part of breast cancer treatment or reconstruction. It can be performed after cancer surgery to help with the symmetry. And not just that, on the other end of the spectrum, when people have lost a lot of weight or had children, it can be used simply as an uplift rather than a large volume reduction. The most important thing is set your goals before the surgery. One of the most important parts of the journey is the consultation. And you and I need to understand what your goals are. Is it pain relief? Is it being able to exercise comfortably, wearing standard bras that you can just pick up from the shop, or simply is it about feeling proportionate? This conversation is absolutely key because a surgery is tailored to you. What does breast reduction actually involve? Breast reduction isn't just about removing breast tissue, it's about reshaping the entire breast. It's about reshaping the breast in a balanced, natural way. We carefully consider breast reduction, the volume reduction, the position of the nipple, the shape and base of the breast, and the quality of your skin. And importantly, the upper pole fullness. This is the fullness at the top of the breast, and it's not always significantly improved with the breast reduction alone. And in some cases, we need to do additional procedures such as an implant, which may be considered at the same time or at a later date. Now, one of the most important factors is weight. This is really crucial, and it needs to be optimum and stable before the surgery. And just as importantly, maintaining that weight after the surgery is equally crucial. Any significant change in your weight, whether it's gain or loss, can have major impact on your results. So how can it affect you? It can affect the shape of the breast, the position of the nipple, and the overall volume, and even how the scars sit on the breast can change after you've lost significant weight. So this surgery works best when it's done at a point where your weight is stable and is sustainable long term. Why every breast reduction is different? Every patient has different anatomy, different skin elasticity, different expectations. So while you may see results online, your outcome will always be individualized. What to expect during your surgery? Now, your procedure takes typically about 3 hours. After the surgery, you'll need to wear a supportive bra, and the key is to wear this supportive bra for at least 6 weeks after the surgery. In the first week, you'll need to keep it clean and dry, and most of the skin healing occurs in the first 2 to 3 weeks. You may notice some small areas that take a little bit longer to heal. It can take multiple weeks for the small areas to heal. But the volume itself can take up to a year to make its final appearance. As with every surgery, we need to consider the trade-offs. It's really important to understand the trade-offs to see whether the surgery is worth it for you. You need to expect scars. The scars are anchor shaped, and you need to expect that there will be changes in your nipple sensation, and there may be a degree of asymmetry. These will all be discussed in detail with you in your consultation. But the benefits is something that you also need to understand. So let's go over the benefits as well to see whether the risks are worth it. Despite this, breast reduction is one of the most rewarding procedures we perform. Patients experience relief from chronic pain, improved mobility with exercise, and significantly better confidence. There's more freedom with clothing and choice, and for many, it's truly life-changing. I've gone over the risks and the trade-offs of breast reductions in a little bit more detail in another video. However, my final thoughts are, if you're considering breast reduction, the most important step is a detailed consultation. This allows you to understand your goals, ensure your weight is optimized and stable, and create a plan tailored specifically for you. If you'd like more information on breast reduction surgery or breast surgery, or you're thinking about whether this is right for you, please do get in touch. Thank you so much for listening, and if you found this video useful, please like and subscribe, and hopefully I'll see you in the next one.